Hi, welcome to the 3M Healthcare Academy webinar. It's a pleasure to be today here with you, and we want to share some kind of tips that we can use every day in our daily practice. So every day our patients come to our office and ask us for some kind of aesthetic work. So sometimes we have more complex cases, other times we have some more easiest cases, but always the final goal is to achieve the aesthetic and also function and longevity of our restorations. So for that we have to follow some steps in our restorative work when we talk about direct composite resin restorations. So always we have to plan the restoration, and planning the restoration is do something like, for example, check before we apply the composite resin, to put the composite resin, is to check if we need to some kind of previous treatments like internal bleaching, external bleaching, some kind of perio procedures, endodontic procedures. All of these together can make the final work more aesthetic and more natural. After replanning, we go for the preparation of the tooth. When we talk about anterior tooth, we have to remove the decay and we have to prepare the tooth for applied composite resin. In this sense, we can usually use the bevel on anterior tooth. So the bevel, the main objective of the bevel is to create some kind of invisible transition between the composite resin and the tooth. But if we want to use the technique without bevel, we have to just overlap the composite on the buccal surface. After we just prepare the tooth, we have to apply the adhesive system. This is the time we should give time for the adhesive application. Why? Because the adhesive is what gives us longevity for our restoration. Also, after we apply the adhesive system, we go for the application, the composite resin. So we can use different techniques, one opacity, multi-opacity, dual opacity. Depends on what? On how many time we have for the restoration, also how much, what kind of materials we have to work with, and also the kind of natural outcome you want for our restoration. In the end, we always have to take care about the finishing and polishing procedures. Why? It's one of the most important steps, because the finishing procedures can give us longevity for the composite resin surface and also can give us naturality for the integration between the tooth, the composite restoration, and adjacent tooth. But at least in the end of the restorative treatment, we have to say for our patients that they have to maintain the composite resin, because the composite resin they are beautiful materials that we can work with, but we have to give some maintenance. So we have to advise the patient for come every year or sometime after some time, for we can just check if the composites are okay, if you need some kind of repolishing, of margins maintenance. So the composite resins needs maintenance. So the first step, when we start the planning, sometimes we start to say, oh, but we need a wax-up. Sometimes you don't need the wax-up. Of course, the wax-up in more biggest case, when we work with several number of tooth, we if you have a wax-up available, it can give us predictability about the final shape you want to achieve. But there are also other ways we can work with. One of the main important things to do is when the patient comes and sits in your dental chair, we should start to look for the natural tooth of the patient, because in this way we can start to see what this kind of effects that start to appear in the natural tooth of the patient, internal effects, the opacity of the dentin, the translucent effects of the enamel. If we can't see with our eyes, we can reply that with our hands and the composite resins materials. So for that, there are different effects we can have on the incisal third of the tooth, in the incisal. So, for example, in young patients who can have some kind of bluish or gray translucence between the dentin and the incisal edge, like Mamelon's effect of rectilinear effect. Also, with some kind of weird or more adult patients, sometimes don't have translucence. So it looks like the dentin touch and go to the incisal edge. And also we have other situations that in just one tooth, we can have in the same tooth different kind of this kind of translucent, opaque areas. So each tooth is a different tooth. We have to look for what we have in our patient and try to reply with our composite resins. One of the tips for we can see more inside of the tooth is to use dental photography. So if you take a photo of your natural tooth of your patient, and if you increase the contrast and decrease the brightness of this picture, it's like we see more difference between the opaque areas, dentin, and more translucent areas, enamel. So for that we can also have some articles that already told us this kind of procedure. Always increase the contrast, decrease the brightness. And you can use like DSLR equipment, or even you can use cell phones with good quality, like the mobile dental photography developed by Louis Ardan. And then in just the software of the phone, we can just increase the contrast, decrease the brightness. With this, we can see more deeper, and if we see that, we can reply in our restorations. Other question is, I have my composite resin, but I have different kinds of composite resins. Which one I should choose for my direct anterior restorations? Well, we can choose a composite resin by the mechanical properties or by the optical properties. If you look for the mechanical properties, this correlate with the size of the fillers of the composite that are inside of the composite resin. We have different ones nowadays. So, but what I want in the anterior tooth, I want a natural restoration, static restoration, and one of the main properties is the polishing. So the composite resins who have the less, let's say the most, the filler with the less size, maybe it's easier to make a good polishing, easier polishing, and long-lasting polishing. So if I have from the hybrid to the nanofill composite resins, for my patients, maybe I should choose a microfill, nanohybrid, or a nanofill composite resins. In this way, I can have a better polishing in end of the restoration. If I look for the optical properties, okay, what I want to reply is what I have on the natural tooth, dentin and enamel. With that, so I can choose my enamel, my dentin, about composite resins, and I use it in my restorations. But for example, if I look inside of the dentin, if you look our natural dentin, the dentin is not only opaque. The dentin have different kind of opacities. If you look inside of the dentin nearby the pulp means inside of the tooth, in the middle of the tooth, they are more chromatic and opaque. And in the dentin, when we just walk and go to the outside, to the enamel, these dentins turn less chromatic and less opaque. That's why the mean and the workflow, when we work with the multi-layering technique about the composite resin application, they try to mimic exactly these effects. So for that, we have this kind of different system of composite resin that allow us to make this different composite approach and mimic all these effects that we have inside of the natural tooth. We have the dentin, opaque dentins, we have the enamels. Also we have between them one body opacity or universal opacity, means that in one syrinx I have like mixed 50% of enamel and 50% of dentin, mixed. So if I don't want to layering, I only just use one syrinx, one opacity, I will choose the body one. You use it a lot on the class 5, class 3, small incisal restorations is more than enough. And also we have some translucent enamels, achromatic enamels, that allow us to make some kind of effects special on the incisal edge. Now, how to choose the shade? We have different ways to make the shade selection in our patients. Based on the Vita shade, for example, this is one of the most usual tools that we use nowadays on all of dental office. We can just make a personalized shade guide, like my shade guide. So with the same composite we will use on the patients, we can just make a shade tab, and maybe it's more predictable in the end to make our shade selection. Other way is some manufacturers had the kind of recipe, and based it on the Vita shade we want to get, you can choose what kind of different opacities and shades I have to put together for in the end have that kind of shade, Vita shade. Other way also, and the most important word about Matisse chroma or value is the value. And based on the value, also you can use in some kind of difficult cases about shade selection, the bottom technique. Means that we should put in the tooth without any kind of adhesion, just select a small ball of composite resin and apply on the tooth you want to copy this color, to check the color, dentin in the cervical medium third and enamel on the medium incisal third. You just place a small portion of composite with light cure, wet with water for the refraction index of the light, and we check which one just fits better with that part of the tooth. Also, about the value, if you just take a black and white picture, it's easier to check this kind of match, and even also better if you use a polarized filter. Okay, we already make the shade selection. Now we have to choose what kind of technique, how many opacities we will work with in our restoration. Of course, this depends of the time we have to restore, to make the restoration, how many sirens, how many materials we have available in our dental office, and the grade of aesthetic we want to have in the final of the restoration. So, for example, if you want something simple, we can use one body opacity, like one body siren. With this body siren, just choose the shade we want to have in the final, and then just if you give a good shape for the restoration, your restoration will fit with the adjacent tooth for sure. So when you want to use a body shade, choose the shade you want for the final restoration. If you want to use A1, use body A1. If you want to have a A3, use body A3, and so on. If we want to use, for example, but I want to have a little bit more aesthetic, not so standard, okay? So then we can go for the multi-layering approach. What is this multi-layering approach? Is exactly following what happened in the natural tooth, like chromatic dentin in the middle, then less chromatic dentin between the dentin and the enamel, then we have the enamel and the effects. So you can use dentin, body, enamel, and translucent shades or opacities to make this multi-layering technique. Usually, these multi-layering techniques are based on the layering technique that we usually use, from the palatal, from the back, to the buccal enamel from the front. So use these different layers of composite resin. With that, we can just start in the restoration, but even it is a big restoration with a great volume, a big volume of composite resin to apply on top, we can just have, let's say, a natural outcome if we use this kind of natural layering system. The question is, can we simplify a little bit this multi-layering technique? Yes. So what we will do, we will use exactly what we have on the natural tooth, the main opacities, the dentin and the enamel. This is what we need. So you can use the dual layering technique. One siring of enamel, one siring of dentin. Also we can use, in some cases, one extra siring. This is the translucent enamel, okay? For which purpose we use this translucent enamel? In situations that in the incisal edge, we have this very translucent bluish gray area. So if you have this kind of translucent siring, it's easier to get this kind of effects. So for that we have different kind of translucents. The one I like to use is this one, is the CT effect from the Filtech Supreme, is the most neutral one we have. So in each situation you want to create translucency, that's the siren I use. And also because of the opalescence effect and counter-opalescence that we have with this kind of material, like we have in the natural enamel. With that, we can reply and mimic what we have on the natural tooth. So instead we have a multi-layering technique, we can use only one dentin and one enamel to make our restoration, like in a recipe. So we can use a recipe for make the restoration. So this recipe comes with our group, Style Italiano. Nowadays we are more than 50 members worldwide, so just get about simplicity and predictability of our restorations. So for we can have this kind of recipe, we can just use one dentin, one enamel based on the viti shade we want to get with Filtex Supreme XTA. So, but for that, for this recipe can work and we have predictability, is mandatory that we can just control the thickness, calibrated thickness of the buccal enamel. The buccal enamel should have 0.5 millimeters. Why? Because this is average for not so a gray outcome or a so opaque outcome. Why usually the restorations come gray? Because or you don't use so much opacity inside of the tooth, or also you put a very thick buccal enamel layer. So the average 0.5 maybe it will be the best for all the techniques, layering techniques we use in our daily practice. So with that, we can just start with this outcome, with this outcome, and with this dual layering technique, very simple, in 30 minutes, we can go for that outcome more natural. So it depends on what kind of grade of aesthetic we want to have in the end. Let's go for some tips about the restorative procedure. For example, one of the first steps we have is the bevel. The bevel should be the most smooth we can and round and polishing we can. For that, we should do more or less 3-4 millimeters of extension of the bevel is enough. And how we make the bevel? Or with a medium fine grain burr, or with a with a grain disc, with a coarse grain disc, usually the red or the black Softflex. With this we can make a smooth bevel and polishing also all the surface. Before we apply the adhesive system, all the surface of the composite should be totally clean. For that, we can use something to clean the tooth. Maybe, for example, the glycerin powder is one of them that you can use to clean all the surface, make this contamination, and then you can proper go and make a good bonding, achieve a good bond, and also the application of composite resin. When we apply the adhesive, we usually have always two tissues to apply when we apply the adhesive, in the dentin and also in the enamel. So, but they are totally different. The enamel is more a micromechanical retention, and we talk about dentin is more chemical adhesion. So usually when we have enamel, don't matter of kind of adhesive we have, you should always make the selective enamel etching. Means that when we have enamel, we have to etch the enamel. Dentin is different. Nowadays we have a lot of different adhesive systems, from the 3 steps total etch to the 2 steps total etch, 2-step self-etch, and universal adhesives. So don't matter what one you use, you should use in a proper and correct way. For example, one of the tips for when you work with the total etch 3 steps or 2 steps adhesive, they are not so tolerant for the moisture of the dentin, is how moist we leave the dentin. So don't dry too much the dentin, don't just leave so wet. So for example, if you, after you just wash your etching and also you dry a little bit, if you see, wow, my dentin is too dry, you have to wet. How to wet? Just pick up a small cotton ball, put water on it, okay, and just pass a little bit in the dentin. Is enough for moist dentin. But when we use special self-etch adhesives or universal adhesives based on the science, on the in vitro and clinical studies, which is the best way to apply in our tooth this kind of adhesives. So if possible, you should use the selective enamel etch technique. Means etch the enamel for 20-30 seconds, don't etch the dentin. Then after we just wash and dry a little bit, we go and rubber well the adhesive in all the surface you will apply, especially on the dentin. How much? How longer? 10-15 seconds. Okay? If you want to ensure that all the dentin tubes are sealed with adhesive, you should apply more than one layer of adhesive and only light cure in the end. After you just rubbing well the adhesive, what should we do? Apply a gentle air. Apply a gentle air for around 5 to 10 seconds until you don't see movement of the adhesive on the surface of the tooth. Then we can light cure. Or longer, 20 seconds if you use the normal nowadays LEDs, or if you use a halogen lamp, 40 seconds may be the best way. Now we just apply the bonding. We go for one steps, for example, that we have the palatal shell, palatal enamel layering. How can we do it? We have different ways to do it, from the silicone index to the wax-up, to a diagnostic restoration, or mock-up restoration, also some kind of acetate crown. But one of the simple ways, like for some kind of emergency we have in our office, is to use a celluloid matrix that you just surround the tooth with your finger, just hold on the palatal on the same level of adjacent tooth. Then you pick up the composite, put the composite on top of the matrix, give more or less the shape you want, and light cure. In this way, it's not the perfect, but you have something that you can start to layering from the back to the front. After you have the palatal enamel layer done, if you see that you have some kind of gap between the palatal enamel and the surround tooth, what you should do, you should apply a small amount of flowable composite resin, any kind of shade of flowable, and just a small amount pass the flow through this gap to fill this part. Okay? In this way, you ensure everything is totally filled and there's no gap between in the restoration. Other step is the proximal enamel. How to do the proximal wall? So we have different matrix that allows to do that. What we want to have a natural proximal enamel, convex. Okay, how to do it? If you use a normal celluloid matrix, they give you usually a rectilinear effect. That's what we don't want to have. So if, for example, if you use this kind of sectional posterior matrix and we use it in a vertical position, we can get this kind of convexity better. So, and how can we fix the matrix in the cervical area for they can bend and just have a good contact point? We can use a wedge, a wood, a rubber, a plastic wedge, thin one for don't deform the shape of the matrix, or you can also use a Teflon roll on the cervical embrasure, or also maybe you can use a blockout resin like from Polydentia, the my custom rings. You can just put a little bit on the proximal space, you light cure, and you have exactly, your matrix will keep always the shape you want to have in the final of the restoration. So with this you can see that this sectional matrix can give you something similar to the shape of the natural tooth on this position. Now go for the dentin. When you have the dentin, we have to first compact the dentin, pack the dentin to the palatal enamel, and also we have to calibrate the space for the buccal enamel, the 0.5 millimeters. How you can do that? Usually with this instrument that's called misura, developed by our group by Style Italiano. So you just hold on the thin part of the misura on the external part of the bevel, you just hold on the large part of the misura on the incisal edge, and very soft, very gentle, you pass side by side. Okay, but if, for example, you work with the direct composite veneer, if you cannot hold on the misura, how can calibrate the 0.5 millimeters? For example, if you have a wax-up, what you can do, we can just have this putty silicone index cover palatal and buccal surface. We cut the silicone index in the middle, and then we have two parts of the silicone. If we just put this silicone on the tooth, we can, with a probe, perio probe, you can just put the probe and you can just check after you put your dentin how much space you have for your buccal enamel. So in this way, you can calibrate from cervical to the incisal the space for your composite resin restoration, even in some situations the Misura don't work. But before we light cure, we have to take care with this step. This is the way you blend, you put the enamel to the bevel. So the tip is, for you have a very smooth surface connection between the dentin and the bevel, use a brush. You can use a brush and you can pass first the brush proximal to proximal on the bevel area. So just make a smooth movement with your brush, first proximal to proximal, and then push from the dentin to the bevel. So when you push the dentin to the bevel, it's like your dentin yields the continuation of the bevel to the incisal. So the dentin should touch and go on top of the internal part of the bevel and make a very smooth continuation. If you want to have this mamelons effect or rectilinear, translucent effects on the incisal edge, before you light cure, you can just modeling with your probe, with a very instrument like the fissura, okay, modeling, and then you can light cure. In this way, you can reply, you can just pass for the restoration, the same effects you have in the mouth of your patient. When you use brush, what kind of brush you can use? Well, any brush you want, and also you can use the brush dry or wet. If you want to wet the brush, maybe this is the two materials you can use, or a modeling resin or a pure adhesive without any kind of solvent. But even if you use some, please use a very, very small amount. Otherwise, you can just damage your restoration, your composite. When we have tooth with discoloration, when we want to cover the discoloration and make a composite veneer. And it's very tricky situation because sometimes we have to deal with these discolorations. How can you mask these discolorations? So, for example, if you see this picture, we have on the left side, you have a body opacity and a dentin. On the right side, we have a dentin, white and a not white dentin. But if you compare the body opacity with the dentin, you see the dentin cover more the substrate, block more the substrate than the body. So maybe when we have tooth discoloration, maybe one of the best materials to use is an opaque dentin and not a body. So if you don't have discoloration, very thin space to work with, maybe only a body opacity and enamel, it's enough. If you have a discoloration, you should use an opaque dentin and then the enamel. How you just work with? Make the preparation for your veneer, so you need space for the composite. Then you apply your adhesive system, etching, bonding, and after the bonding and you light cure the adhesive, you have to apply something to block this discoloration. So you can use or white stains or opaque white dentins. So you have some kind of white opaque stains or Vita opaque stains that you can apply to mask this discoloration. You should usually have 80% of masking this discoloration, or even the white dentins. So this is usually the dentin I use when I have a tooth with discoloration to block the shade of this discoloration. Why? Because it's a very opaque dentin. And why white? To give more high value for the tooth. So after you apply or the dentin or the stains, you just light cure and you apply the dentin you want for the final shade of your restoration. Means if you want A1, just put dentin A1. If you want A3 final shade, just put dentin A3, light cure, and then apply the final buccal enamel. With this, we can mask the discoloration and give the shade you want for the final restoration. Other technique we have also to guide us in a predictable result with the veneers, and also use the same materials, the same composite resins that we work until now, is the semi-direct technique. So imagine, for example, a patient have multiple diastemas, change of the shape, some tooth missing, some also erosion. So what we need to do? First, we need to check the space we have available for each tooth. What you want to get in the final, the width, how much longer are the tooth. This is planning. With that measurement, we can choose the size of the tooth that fits better on that spaces. So for example, you can use already pre-existing models, like example from Dr. Acho, and they are from females, from males, from upper jaws, lower jaws. So you can just make a silicone index from the buccal buccal surface of these models. And just on this silicone index, just build up very thin composite veneers. For example, if you want A1 with A1, if you want final shade A2 with A2, how much thin you can do these composite veneers better. And then you just adapt with the contour you have of the gingiva, of the proximal spaces you have, adapt on the tooth of your patient, okay, these composite veneers. And then you only have to bond the veneers with the same composite resin. So usually the veneers who made these veneers in enamel, okay, and we just to bond the veneers we use dentin. This composite that we use for bond the veneers on the tooth will fill all the space just to the tooth looks like everything natural. With this kind of technique, in some cases are just one, let's say one appointment, consultation, and we can also have a natural outcome with the restorations. We can just pass for erosion with a losing of the shape and diastemas, and in a very easier technique we can just have everything we get in the first we have with the nature, we can give back for our patient. So it's also other solution we have for some cases that we want to go with a more predictable, let's say, shape in the end, compare with a direct application of composite resin. So it's like you just invert the layering technique. Just apply the composite from the buccal to the palatal, okay? On other side that you apply usually the normal layering technique with a direct composite resin. So let's finish now with the final step. This is the polishing and finishing of our composite resin. With this we can go in two ways. Or we just smooth the surface, take care about the shape, smooth the composite and give the final glossy surface. Or also if the patient has some kind of texture on the surface of the tooth, we can give back also this texture for the composite resin. So what the patient have, you should also reply in our restoration. So we have three kind of steps on this polishing, if you want to talk about also the texture. So the texture, the macromorphology, the shape of the tooth, this is the main goal that all gives the, let's say, that the tooth, the restoration in the end looks like a natural tooth, is the shape we give for the restoration. More important than the opacities we apply inside of the restoration. So this shape we just divide the shape in three steps. First step, angle lines. So the angle lines give the shape of the tooth. Between the angle lines we have a flat surface, eye shining, eye reflective surface. On the sides of the angle lines we have a shadow areas, round surface. Other step is the incisal embrasures. We can be more round or more straight. Usually the distal one is more round than the mesial one. And finally, the angulation of the 3/3 of the buccal surface. Cervical inclination, medium third inclination, incisal inclination. So for example, if you work with a direct composite veneer, we have to check if your restoration, if your buccal surface have this kind of profile. After that, we go for the smooth, the polishing of the surface, or we can give texture. If the natural tooth have some kind of macro texture, usually we use the V-shaped grooves, that is the pressures we have, the grooves we have between the lobules of the tooth, and also you can have some kind of horizontal grooves on the cervical third of the tooth. But the most important one is the vertical grooves, the V-shaped grooves. If the patient are young, sometimes we have this kind of micro texture, the perichimathias, very thin lines that comes from horizontal, from cervical to the incisal side. So we start the polishing with polishing the interproximal space with interproximal strips, and especially if you use very thin ones, and you should use that in an S-italic movement. If you use in an S-italic movement, we don't broken the contact area, the contact point, so you keep it. Also, other tip is you can also put some polishing paste on your polishing strip and pass between the tooth. In this way, you have a smoother surface. So you can use burrs, rubbers to make these steps. The first step about the shape is to correct the angle lines. So you can pick up a medium fine grain burr, put 45 degrees to the tooth surface, and go and pass until you touch the angle lines. Other way is to use a soft flat disc, medium grain, like the dark orange, for example, but also 45 degrees to the tooth surface. Then you go for the inclination of the thirds. Put your burr in the way you want to reply the area you want to correct, the cervical third, medium third, or the incisal third. But the inclination of the burr is important to get this profile. Finally, we go for the incisal embrasures. So how can we just round or straight the incisal embrasures? With the grain disc is the most easiest way. We have different ones. Usually for these steps I use the two in the middle. So if I want to remove less composite, I use the light orange. If I want to remove more composite, I use the dark orange. I don't use usually for this step the red one or the yellow one. So we get the shape of the tooth. Okay, if you want to add some texture, we can pick up a medium fine grain burr. With a pencil, draw these grooves you want to create in our restoration, and then you can just pass a very slow speed your burr in the surface of the composite. But we not have like a very smooth outcome. So after you pass the burr, we have to pass something to smooth, to turn it more natural. So you use a rubber. In the same areas you pass with the burr, you pass a smooth rubber to smooth these grooves. If you want to reply this natural effect, the perichimathias, on the restoration, which kind of instruments can we use? Pick up the most thin burr you have in your office, put 45 degrees to the tooth surface, and then you start to make very, very smooth lines from the cervical to the incisal third. How much thinner they are, how much closer they are from each other, more natural outcome we will have. So now we have the last step. We want to have a glossy surface. How can we get the glossy surface? We can use these spirals, the soft flex spirals, for example. We have two. We have the badge and the pink one. The badge is a pre-polisher, so don't make too much pressure on the badge, the spiral. So only smooth pressure, otherwise you remove the texture you give to the tooth, to the restoration. And then we pass for the pink one. With the pink one, we can make pressure, round movements, and special use water. If you use water with the spirals discs, you have more easier polishing and faster polishing. One of the advantages, they are so thin that you can also go in the interproximal space. To finishing, you can finishing here, or if you want to have a more even high glossy surface, you can use a small amount of polishing paste with a very fluffy felt. Okay? So use any kind of polishing paste you want to use and just a smooth felt. The outcome we have is exactly this. So if you follow all the steps and just finishing with this polishing paste with a felt, this is what we get. A high shining, high glossy surface and mechanical polishing retention. This is the important and the final goal about our composite resin restoration. So look, just apply a small amount of polishing paste, then you pass very gentle with the felt, round movements. Please be aware of the eating of the tooth, so be careful, don't put too much pressure, otherwise you start to eating the tooth. But after some seconds you can start to look and to get this kind of high glossy surface. This is the mechanical retention, the same we have on the natural tooth, on the ceramic. Of course, it's a composite resin, they need maintenance, but you have the natural outcome for the restoration. So if you follow all the steps, for sure you can get a predictable outcome on your direct composite restorations. We are not gods, but we cannot give back for the patient what they lost about the natural tissues. But we have nowadays materials and techniques that allow us to recreate and to mimic all these natural effects. We only have to see and to reply with our hands. Thank you so much, and I hope these tips will be useful in your daily practice. See you soon.